Hi, my name is Dr. Eric Arzubi. I'm a board-certified child and adolescent psychiatrist. I'm an assistant clinical professor with the Yale Child Study Center, and I'm CEO of Frontier Psychiatry here in Montana. So today we'll be talking about school refusal and some of the important topics we believe would be important for you all to know about so we can help children and their families as much as possible around this pretty difficult issue. So I've taken some notes here that I'll use to guide the conversation, but first let's start with the definition. What is school refusal? Right, so it's a complex problem that involves a lot of difficulties in attending and staying in school because of emotional distress associated with it. It's pretty common. It comes from a combination of anxiety and fear, and isn't really a DSM diagnosis, right? DSM is kind of the Diagnostic and Statistics Manual for Psychiatry, so it's not in the DSM-5, but it's really it's not a diagnosis, but it's under a category of school attendance problems, and in the past have been called school phobia. So what are some important distinctions for us to be aware of for those of us trying to support children and their families? So in school refusal, the child experiences emotional distress, and the parents know that the child is home. In truancy, which is different, the child skips school and hides it from parents. School withdrawal. In school withdrawal, parents actively encourage non-attendance, right? So those are three different issues. And these distinctions are important if we're really going to think about how to support families and their children. So there's a child psychiatrist, I believe from the 1960s, called Dr. Ian Berg, who came up with some criteria to help us define school refusal. So these 5 criteria include reluctance or refusal to attend school, being at home during school hours with parental knowledge, emotional distress at the prospect of going to school, which is really a central feature of this problem, the absence of severe antisocial behaviors, so beyond kind of resisting school attendance, and reasonable yet ineffective parental attempts to enforce attendance. In other words, parents have tried to do something, but it's just not working. So this affects actually up to about 5% of all school-age children. One study found that there's 4% of absenteeism because of school refusal. It's most prevalent in kids aged 5 to 10 years old, and it's often described as a pretty significant problem and a frequent mental health issue in lots of healthcare settings, school settings, and really the settings where parents and families go for help. So what are some common ways that this presents? Well, there's difficulty separating from parents, especially during school drop-off. There's avoidance of anything that's school-related, like bus rides or specific school activities. There's specific or generalized school anxiety, like fear of public speaking or fear of speaking out in classroom. There are tantrums in school mornings, refusing to leave home, leaving school when feeling distressed, and staying on school grounds, but outside the classroom. There are some physical symptoms that sometimes accompany this, including stomach ache, headache, nausea, vomiting. There can be tremors, muscle tension, diarrhea, lightheadedness, fainting, palpitations, dizziness, shortness of breath, hyperventilation, sweating, frequent urination, wanting to go to the bathroom a lot, right? Sleep disturbances, and extreme tiredness. The behavioral emotional symptoms include crying, screaming, kicking and shaking, difficulty focusing, poor mood, intense sensitivity in relationships, social withdrawal, problems with peer relationships, and loneliness. Now, there are, beyond not being able to go to school, there are some different sort of broader impacts on the child and the family. So, for example, short-term impacts on the child include problems with family and peer relationships, increased family conflict, academic performance tends to drop, high daily emotional distress, and there's often a co-occurring mental illness. So even though school refusal isn't really a DSM-5 diagnosis, often you'll see a DSM-5 diagnosis that will accompany school refusal, so including a depressive disorder, an anxiety disorder, and the like. You can see increased aggression and antisocial behavior, emotional exhaustion, low school attendance, risk of legal problems, and risk of juvenile delinquency over time. The short-term impact on families can include significant parental distress, constant dialogue with school staff, having to have conversations over and over again. The school may think that parents aren't doing enough, and the parents may be frustrated that school isn't doing enough. There are changes in daily routines, problems with overall family functioning. The parents may start feeling bad about themselves, feeling guilty, like they're inadequate, or feel like they're being blamed. And the stress affects relationships with other children in the house. There are also longer-term consequences or problems associated with this. You'll have reduced career opportunities when it comes to a child who's struggling in school, poor interpersonal relationships over time, disrupted social, emotional, and intellectual development if it goes on over time. And when we're talking about long-term consequences, that's if you see school refusal for 2 years or more. You could have higher rates of mental illness over time and over the lifetime, higher risk for school dropout, more likelihood of engaging in criminal activities, potential substance use and addiction down the road, potential violent tendencies and suicidality, risky sexual behaviors, unemployment, financial difficulties, professional and marital problems. Again, these are long-term consequences if school refusal continues 2 years or more. So overall, the longer the duration of school refusal, really the worse the prognosis, right? So this is something you want to nip in the bud as quickly as possible and really make this a team effort to support the parents, the caregivers, as well as the children. So what are some risk factors? Risk factors sort of at the individual level, at the child level. Who are children who are maybe more likely to start having problems with school refusal? Well, these are children who may have high sensitivity to fear. They're anxious. It could be general anxiety, school-related, social anxiety, and separation anxiety. More problems with mood and emotional self-regulation. Could feel low self-esteem, feeling like they're not enough or don't really have a lot of things that are their own skills that they can own and really feel self-efficacy. Tend to have negative thinking patterns, inadequate problem-solving skills, kind of a neurotic personality, feeling kind of perfectionistic. They may have been bullied, either online or in person at school. They may have had difficult childhood experiences, in particular adverse childhood experiences, traumatic experiences in the home. Maybe some neurodevelopmental problems, including autism spectrum disorders or ADHD. And associated with that, as you can imagine, are problems with self-control in terms of emotions and impulses. The families overall could have some risk factors that increase the likelihood of developing problems with school refusal. So parents might have problems with mental health, like depression, anxiety. There could be overall poor family functioning. Mom might be overprotective. There could be a really high pressure to perform and high expectations from the family. Maybe the family doesn't feel connected to the school. They feel like the school's mission isn't aligned with what the family's looking for in school, and that'll come across in conversations with children. There might be some negative living conditions, could be lower family education level, single parent households, inadequate parent-child interactions, and the family sometimes accommodates around the child's anxiety. And essentially what that means is even though the family doesn't really want to or is trying to avoid it as much as possible, the family will sometimes bend to really what the anxiety of the child is calling for. And so instead of just fighting it or worrying about, what happens when the child blows up, the family may just kind of give in, and the child learns that the family ultimately gives in, and the anxiety can get worse over time. There's some risk factors around the environment and the school. So, for example, there might be insufficient teacher support and supervision. There might be some really unpredictable school experiences that has to do with the school environment. There might be a problem between the home and the school communicating and collaborating in service of the child. There might be too many school transitions, some social inequities, and if the child or the family is of minority status, that could play a role. There could be lots of extra pressure on teachers, big curriculum demands that make sort of the school environment a little bit more challenging. And there could be, in general, test anxiety related to that school performance issue. So most cases don't get better without some form of intervention or treatment. And it's nearly impossible to treat without the parents being involved or the caregivers being involved. So you got to involve the parents. You also have to look at intervening at a couple different levels, right? A child is a part of several systems at once, right? There's the family system, the school system. And so you really need to involve the child, the family, and the school at once. Family therapy can be effective in earlier stages of school refusal. And cognitive behavioral therapy with some parent sessions can be as effective as a treatment that focuses only on children. So again, critical here is involving the school, the family, and the child. You can't just focus on one particular individual here. In terms of general recommendations for families, you want to make sure you're addressing any parent mental health problems, right? Because if mom or dad or whoever the caregivers are struggling with mental health problems, being able to support the child is going to be a lot more difficult. So make sure you're focused on the parent's psychological health. Then you want to make sure you're providing support to the family so there's improved family functioning overall. Help work on communication and reducing conflict. Also, if possible, get in touch with a parenting expert. And again, I think we all need parenting experts. Nobody was born as a perfect parent, and not many people that I know of have actually had perfect parents. So we all can use support and help in this area. So seek out a local parenting expert to help parents, kind of balance protection of the child with encouraging age-appropriate autonomy and independence of the child, right? So you don't want to overprotect. You don't want to kind of let too loose, but there needs to be a balance. And again, a parenting expert can often help with that. You definitely want, like I just alluded to, you want to seek professional intervention that involve parents. So again, not only parenting support, but maybe counseling, family therapy, and parent-mediated interventions. And really focus on building a good relationship between and communication between the family and the school team. That's critical. So again, overall, school refusal is complex. It can be serious, and the longer you let it go, the more problematic the long-term outcomes. And it requires interventions at several levels, including the child, the family, and the school. Early intervention is critical, right? The longer you let this go on without intervening, the more problems you're going to have in the long term. You need family involvement if you're going to be successful at really supporting the child and the family. You need collaboration between mental health professionals, medical providers, and schools. Again, it's a team effort. You gotta address any underlying problems, right? So if there's school refusal and the child has ADHD or autism spectrum disorder or major depression, you got to make sure you're treating the underlying disorder as well as the school refusal issue. And you want to consider both the individual and system-wide challenges when you're addressing this problem. And here's some important questions that you might want to keep in mind when you're working with a family, caregivers, or the children, and even the schools to help support someone who's struggling with school refusal. What are the specific fears or anxieties that are present? How is the family functioning overall? What are, if any, the parent mental health factors or problems that are going on? How long has this been going on? That's critical, right? Don't want to let this go on longer than you have to. What are some school-related factors that might be contributing to the problem? What other interventions have been tried and maybe haven't worked? And are there any underlying medical conditions that could be contributing to the overall problem? So again, thanks for taking the time to listen to this. I hope that this has been helpful. And again, just remember this problem, like most of the mental health problems that we encounter in the families, the children that we serve, it's a team sport. It takes a team, and really trying to work at this from a more comprehensive approach, including at the individual and the system level, is always more effective. And let's do our best to communicate with one another in support of the children and families that we serve. Thank you.